Okay, guys, so we have been working on a particular case, which, my lovely patient agreed to kind of do a video because it's hopefully going to help you guys as well. So she was experiencing lots of pain under the sole of the foot, and particularly in this area, and you wanted to get an injection.
Yes.
Right? So I suggested that we should probably do, before she goes and gets an injection, a session of adhesion breaking. So as I run my hand over the arch of the foot, I can feel this one line that's a little bit harder compared to the rest of them. These are all soft, and then when we get here, it's a little bit more rough. And I could feel that this is not, you thought it was a bone,
Yes.
right? And when I ran my finger through it, we said that it's not a bone, but it's a scar tissue. You can see these little notches throughout the foot. And when there's constant pressure on one particular part of the foot, then the brain is going to kind of do like a little zigzag and start to fuse these together to create a stronger support for the body. And when you have that, then there is obviously a bit more pressure or lack there of mobility, so then it starts to cause pain. Now you might be able to see that when I start to stretch the tissue out, so you can kind of see that redness there, and you can see a little bit of a line here. So we're going to do our second session of adhesion breaking. This is a very painful process, so patients who do get this treatment done, expect to receive a lot of pain, but also a lot of relief afterwards. Yeah. How many days did you feel better?
A day
Since
after.
the next day you felt
Next day I felt much better. Yes.
Okay. And there is a little bit of tightness that kind of wraps around here too, and then when we kind of turn the foot this way, the pain also went away. So it's one of the tendons that come back from the back of the ankle, wraps around into the foot. So we're going to kind of give a few of those exercises where patient is going to take the ankle into pronation, and hopefully that will strengthen the tendon here, and then hopefully she'll have less pain. Okay, so I'm going to get started. Are you ready?
Yes, I'm ready.
All right. So what we're going to do is I use a little bit of Graston cream, and then we're going to almost prep the tissues before we get started. And then we're going to get a little bit more specific as we find those painful areas. Yeah. So, I'm going to kind of zoom out a little bit on the phone too, so we can actually see the whole procedure. Okay. I'm going to ask you to kind of flatten out the foot here. Perfect. So this is going to give me a little bit of leverage to work through this tissue. I'm going to start a little bit lower, and we're not going to go quite as deep just yet. This is still quite tender because she has some pain there already. Is it less than last week?
It's way less than last week. Yes.
Okay, and you have a little bit of pain here too.
Yes.
Yeah. Is that painful right now or no?
Not right now.
Not right now. That's good.
We're getting there.
We're getting there. Maybe that might be a little tender there. And you can actually feel as well. So when you start to go through those tissues, as the scar tissues start to break, you can actually feel it. Now, I'm going to start to dig really, really deep into the sole of the foot with this one. Okay. Oh, yes, she's definitely feeling the pain. You just make sure you apologize to your patient because you're about to put her in quite a bit of pain. All right. So now we're going to get started into that tissue. All right, here we go. Now the way I want to do this is a little bit of a scooping movement, right? So we start at the edge of that scar tissue and we start to just really dig deep, and this starts to break down the scar tissue, and she's going to feel a lot of softness through those tissues, and in turn
Don't forget
much
to keep
less
breathing.
pain. Yes, do not forget breathing. The deeper you breathe, the easier you can handle the pain. You can feel that one. That's a
Yes.
lot right there. It's literally like jumping over a speed bump right there.
Exactly.
Boom. When you go over this tissue, so if I'm just superficial on it, right? I jump over that tissue. That's not going to break this. So if I continuously do this softly, it's not going to break those tissues. But when I start to find out under the tissue that's underneath it that it's soft, and then I start to scoop that movement forward, then this is what's going to break the scar tissue. Yeah, this one is getting there.
Yeah.
I need a little bit more leverage. And you need a little break.
Yes.
There we go. Are you ready?
Yes. Ah.
It's almost done. Almost done. I know. There it is. And you guys can see that's actually the little white part there. It's exactly that, the anchor of that scar tissue. So we're gonna kind of break it up a little bit more. Pointy end of the tool.
Oh.
I know. You okay?
Yes.
Just a little bit more. We'll be done.
Combination of ticklish and pain.
But you don't laugh though. It's more pain than
More
ticklish,
pain
huh?
than ticklish.
I got you. Yeah. Unfortunate. But the relief is well worth it. Like
yes.
there was a big
Yes.
difference from the first session that we did this. You could
Yes.
sense how hard the tissue was. Now, even after 1 week has passed, you can feel it's a lot more softer,
Yes.
right?
Yes.
So hopefully, and we talked about it may take us 2 to 3 sessions to get this to fully go away, but if we're making good progress and this is breaking up a little bit, it's obviously better. You guys can definitely see, I mean, yes, it is red because I've been working on that tissue, but you can see that this one right there, that little line right there is red, and that's where the hard tissue is. So all of these guys on the side, there's red is a tissue that's already soft, but this one that is super red, it's that hard tissue that we're trying to break. Now I've caused a little bit of blood flow into that tissue, right? So that blood flow is going to start to warm the tissue up. It's increasing the metabolic rate, and it starts to hopefully break down. I can feel it even a little bit softer now. But it's from here to here that she's getting a lot of pain. And so when I do that too, you can kind of see that little white line right there. I almost wonder if there was something that has gone in your foot, like a shard of glass or something, and it just kind of it's stayed. You know what I mean?
Yeah.
That's a possibility that has happened, but it's gotten like super deep into the foot. Yeah, it's almost at the end.
Yeah, I can feel it. Oh!
Almost. Last one. Last one. Last one. Last one. Last one.
Oh, enough. I can't take it.
It's last one. Last one. There you go. So now, just like last week, we're gonna go do a taping around it as well. So I'll come back and show you guys the kind of taping that I do as well. Okay, so we're gonna do some Kinesio taping. The purpose for these tapes is to create a little neuromusculoskeletal re-education for the body. So the brain can interpret what tissue needs to do what. So we talked about how I'm gonna have her do this exercise so that gets that ankle into pronation. So I'm gonna kind of have her keep this ankle into pronation. And you can see the redness here. So that's kind of where the attachment goes. Very laxed on this part of the tape. You wanna really create a bit of friction because the adhesion or the adhesive glue gets a bit more sticky when it gets a little warmer. And then from then, you want to create a little wrap right around all the way to the side of the leg. And then the rest of it is going to be slack again. Okay, and we got a little, since it was towards the end of the tape. And the last time we did this for her, the tape stayed for about 3 to 4 days. And you don't want to assist the peeling. It should kind of peel on itself. So, you know, once the edges start to come off, then, you know, you're almost ready. So now, because there's tension through the tape, it's gonna almost automatically pull the ankle in this direction, even though her foot might be in rest, because there's that tension there. So the deep neurological responses will still be there, right? So you kind of want to make sure that that is done in the proper direction. I do see a lot of athletes who just tape their foot or their ankle or whatever joint that they have in such a way where there is nothing happening neurologically. If you do that, you're just kind of taping for the looks rather than actual results. So be mindful of that. And, you know, we're just gonna do a nice little support tape as well around the ankle joint. Kind of wraps around. Kind of wraps around. It's okay. And this is just going to give her a little bit more stability and keeps the ankle nice and stable. So we're now going to adjust the knee, adjust the ankle, and then yeah, that'll be done.